Hi, my name is mukhriz bin Puzan, normal metric U4230297. Today, I will be presenting about endometrial cancer. In these presentations, I will cover the basic understanding of cancer, the endometrium, causes and risk factor, diagnosis, and also case study including chemotherapy preparations. First, what is cancer? Cancer is a complex disease that happens when abnormal cells in the body start growing and divide uncontrollably. These abnormal cells can invade nervous tissue and may spread to other parts of the body through the blood and lymphatic systems. Even though cancer can be life-threatening, early detections and modern treatment have improved patient outcome significantly. What is endometrium? The endometrium is a mucous membrane that lines the inside of the uterus. It is the tissue that sheds during menstruations, which is the period. It also plays an important role in pregnancy because it helps upon implantation of embryo. This lining is very dynamic as it continuously changes and regenerates during the menstrual cycles. In fact, it can regenerate about 400 times throughout a woman's reproductive life. Now, moving on to causes and risk factors. Endometrial cancer develops when cells in the uterine lining undergo mutations, leading to uncontrolled growth. The main causes is hormonal imbalance, especially when estrogen levels are higher than progesterone. This continuous estrogen stimulation can cause abnormal thickening of the endometriums. And the other important causes and risk factors include, which is obesity, increased estrogen productions, diabetes, hypertension, PCOS, as known as polycystic ovary syndrome, genetic factors such as Lyme syndromes, and last but not least, age above 50, especially after menopause. All these factors mainly increase estrogen exposure or cause abnormal cellular change. Now, I will explain how endometrial cancer is diagnosed. The first method is pelvic examination. In this procedure, the doctor inserts a gloved finger into the vagina while pressing on the abdomen. This helps check for any abnormal size, shape, or masses in the uterus. Next is transvaginal ultrasounds. A small probe is inserted into the vagina. We'll use sound wave to produce image of the uterus. This helps measure the thickness of the endometrium and detect any abnormalities. Another method is hysteroscopy. A thin light tube is inserted through the cervix into the uterus. This allows the doctor to directly see the inside of the uterus and identify any abnormal growth. Finally, biopsy is the most important confirmatory test. A small sample of endometrial tissue is taken and examined under a microscope to confirm the presence of the cancer cells. Treatment options include surgery, radiation therapy, chemotherapy, hormone therapy, or targeted therapy. Early diagnosis is very important because it allows more effective and less aggressive treatment. Now, I will present a case study. The patient is 30 years old, female, diagnosed with endometrial cancer. She is currently undergoing her 6th cycle of chemotherapy at KPJ Ipoh Specialty Hospital. The chemotherapy regimen used a paclitaxel combined with carboplatin, administered every 3 weeks. Pre-medications. Before chemotherapy, pre-medication are given to reduce side effect, which is granisetron is used to prevent nausea and vomiting. Controller is given for gastric protections. Piriton acts as antihistamine to prevent allergic reactions. Dexamethasone help reduce inflammation and hypersensitive. Maxolon is also given as an antiemetic. All these medications are given about 30 minutes before chemotherapies. Before starting chemotherapy, hydrocortisone is given to reduce allergic reactions. Paclitaxel 260 mg is prepared in 250 ml normal saline and infused over several hours. Then, carboplatin 600 mg is prepared in 250 ml normal saline and infused over 60 minutes. After that, a normal saline flush is given. The patient blood result must be normal before starting treatment. The treatment is done in a daycare center and the main aim is to control tumor growth and prevent disease progressions. For the case study, this patient is undergoing a standard chemotherapy regimen using placenta and carbamate every 3 weeks. So treatment summary, this patient is undergoing a standard chemotherapy regimen using a paclitaxel and carboplatin every 3 weeks. Pre-medication are important to reduce side effects like nausea, inflammation and allergic reactions. These protocols follow standard clinical guidelines for treating advanced endometrial cancer. First, remove 43 ml from the normal saline bag, then withdraw 43 ml of paclitaxel from the vial. Finally, add into the 250 normal salines. For carboplatin, the available strength is 450 mg in 45 ml. To prepare 600 mg, 300 divided by 450 multiplied by 45 equals to 60 ml. So 2 vials are needed. For the method is, first remove 60 ml from the normal saline bag, then withdraw 60 ml of carboplatins. Finally, add it into the normal salines. So in conclusion, endometrial cancer is a serious disease caused by abnormal growth in the uterine lining. Understanding its cause, diagnosis and treatment is important for early detection and better patient outcomes. This case study shows how chemotherapy is carefully planned and prepared to ensure both effectiveness and patient safety. Thank you.